Many patients are going to ask me, what is my teardrop augmentation mastopexy? It's a long line to basically explain my particular technique that I invented for a lift, a breast lift, with an enhancement of breast volume or an augmentation. Those two words are contrary. Think about it. In one sense, we're lifting up the breast, and the other, we're putting a heavy volume, a new implant in there, which sort of pulls the breast down. So we need to have techniques that don't fight one against the other. So what my teardrop augmentation mastopexy is a way to lift up a breast and reshape it so that it has more of a teardrop shaped, a narrower, higher pole at the top, followed with full projection at the bottom. It sort of looks like a teardrop. And that's the goal of this particular technique. Now, in specific, many patients, after they've had babies and after they've breastfed, they come in with a flat, sagging breast with a lack of volume. But even with a lack of volume, the upper pole of their breast is very wide. So they're wider at the top, narrower at the bottom, the opposite of what we want. So we want to reverse that. My teardrop augmentation mastopexy takes the breast tissue and lifts it from above. And this is the unique part. Many other technologies sort of lift from below the implant. In this one, we take the breast tissue, lift it from above, but because it's wide, I actually narrow it. And as I narrow it, it creates that sort of teardrop shape. We give you upper pole fullness, but not so wide at the top, so your breast doesn't look so broad. And then we put the implant in below the muscle, so it doesn't pull on the breast tissue. If anything, the implant actually holds the breast tissue up, and that allows for a longer durability to my lift. It doesn't go away in a year. It lasts for 15 or 20 years. And that's the basis for this teardrop, change in the shape, lifting from above, augmentation, putting an implant in. And with that, I've had great experience. We started doing the procedure in 1998, and I've had many happy patients.